Hey, good morning, everyone, and welcome to EuroNurse. We meet here every Saturday at 9 a.m. Central Time. If you're watching us on YouTube, LinkedIn, or Facebook, glad to have you on board. For those YouTubers, be sure to hit that subscribe button. You've been doing a great job. Subscriptions have been going up every week, so I really appreciate it. This is your first time joining us on EuroNurse. Be sure to check us out on euronurse.com, our website, where you can find out more information about the show. It's also the best place to go to watch all of our past episodes. And be sure to check out our new section called EuroNurse Plus. That's the best place to find the audio podcast on any of your favorite podcasting so you can listen right in your car. If you haven't had a chance to subscribe to our newsletter, go to the website. Just sign up right there. It's there for you to get your newsletter every Monday with all the information about what's going on in the show. Also, if you're watching and you want to send a question in, use your comment box. No matter how you're watching us, the comment boxes show up on our show, and we'll be able to talk to you directly or answer your questions directly from there. This week, we're joined by Gloria Kolb, who's the CEO and co-founder of ELITONE, which is a really neat product we're going to talk about today. And let's go ahead and bring our experts in right now. So, hey, experts, welcome to the show.
Good morning, everyone.
Good morning. So as our usual format, we'll do our introductions here and also going to go into our favorite stories and a new thing, interesting facts. So some of us might have some interesting facts for you. I know I do. So my name is Vic Sinise. I am the host and producer of the show. Been involved in urology for 40 years. Had worn many hats from managing the practice to being a practitioner. So I'm going to get right into my interesting fact here, though. What you might not know about me is I used to be a singer in a rock and roll band. It's true. There was a group of us that got together after high school, started a band. That's me right there in the center, in case you can't tell. A little younger, huh? Boy, the 80s were great. Now, here's the interesting story, though. So we did have a band. We played together for about 25 years. One of the events that we played for, I got to meet Miss America back in 1988. Now, the interesting part of the story is not the fact that I got to meet Miss America. That was pretty cool. But if you notice, she was also an RN. So that's my claim to fame. And I got to meet the famous nurse who was Miss America. So there's my interesting story and my bit of moment. So let's go ahead and bring in Andrea for your introduction.
Good morning, everyone. My name's Andrea Strong. I'm a nurse practitioner in urology in Wisconsin. I've been working as a registered nurse since 2010 and pretty much always in the specialty of urology. I'm certified as a urology registered nurse. I'm also the educational director for the Chicago Metro chapter of SUNA. And I am so happy to announce that I was recently elected to the National Board of SUNA on the board of directors. Thank you. So I just want to thank everyone from the bottom of my heart. Thank you very much for voting for me. I really appreciate it. I don't take this job lightly, and I look forward to continuing with SUNA and continuing with EuroNurse. Thanks.
Great. All right, let's bring in Lori.
Hi, my name is Gloria Atkinson. I am a certified registered urology nurse. I've been in urology for 25 years. I currently work in Illinois, in Geneva, and Winfield, Illinois. An interesting fact about me, I don't even think you guys know, I have 5 kids, I have a 30-year-old, a 28-year-old, 23-year-old, and 21-year-old twins. Wow. Luckily they're all older and out of the house, but I also have 3 grandchildren, and I have one on the way that's due. Her due date is 26, so she's due any day now. So super exciting.
Wow. Congratulations.
Thanks.
All right. And now we've got Lace, who was one of our presenters a while back. I invited her to join as our expert. She did such a great job. Go ahead, Lace.
Well, good morning, everyone. I'm Lace Heidemann. I'm a nurse. Have been a nurse since 2011. Most of the time as a nurse I've had in urology. Also currently certified in urology. Love the area. Fun fact, I guess not necessarily about me, but just about group of friends in general, even in healthcare. So many of my friends have had children, are young, and think urinary incontinence after having a child is common. They deprive themselves from jumping on trampolines or, sometimes participating in various other activities, and think it's normal to leak when they cough or sneeze. So very excited to hear about this product, and obviously continuing to educate everyone out there that it is not normal to leak. So
Absolutely. Well, great. And now our presenter, Gloria Kolb, go ahead and let us know a little bit about you and if you have a favorite story.
Yeah, well, thank you. I'm so excited to be here. I'm Gloria Kolb. I'm the CEO and co-founder of ELITONE. And I'll go a little bit into my background later. But one thing that I like to start off with is I consider myself an entrepreneur first, maybe an engineer second. So as an entrepreneur, we are always pitching to get funding. And I do remember one time where I was pitching into a group of angel investors. There were 50 men in the room. And I kept saying 1 out of 3 women has incontinence. And then later I was told that the discussion was, no, I've never heard of this. It must not be a problem. It's my wife, nobody talks about it, so it's not a problem. And that was the reaction I got from the men. So we have a lot of work to do for education and bringing awareness to the public, really.
Yeah, absolutely. All right. Are you ready to start your presentation?
Sure.
All right, here we go. So go ahead, take it away.
Yeah, so we're ELITONE, and we are restoring continence, but really confidence in women. So my background is I have engineering degrees from MIT and Stanford, and then I got an MBA in entrepreneurship from Babson. Won a number of awards, but really, I started my engineering career on missiles, working for the Defense Intelligence. And I realized at one point when I was like, I'm working on products that hurt people. And I really wanted to help people. So that's when I transitioned into the healthcare field, and I've loved it and stayed ever since. So I started off my career at Johnson & Johnson, designing hip implants. And I loved working for J&J in a big company because that's how you learn how to do things the correct way. And then I moved into a small urology startup that I started myself and a urologist. We had a line of ureteral stents, expanding ureteral stents for kidney stone removal. I realized how hard it was to get into the hospital system with one product, when they have contracts with these large companies. And then we've moved since then. But really, the mission of ELITONE is to get women to be active again, to give them something so that they can start living again. So we've won a number of awards, but one thing I just wanted to point out is we've been mostly grant funded. The government realized how big of a problem incontinence is. So we got a lot of our initial funding from NIH, NSF, and Department of Defense. So I do like to start off with the end goal in mind. And so in this story, Sherry, who this was published in the Women's World last December and totally unpaid for by us. She talks about how she wasn't dating, she wasn't going out. Incontinence really hindered her lifestyle. And then now, after using the ELITONE device, she bought an RV. She's traveling the country. She is so excited. She got a new puppy. She's like, her life just transformed again. And she said she's saving so much money on pads. And that is our goal. That is what we do, really. So I probably don't have to remind you how common it is, 1 in 3 women over the age of 30. But I also wanted to point out how really depressing it is and how early it starts. Lots of times earlier than people think. A lot of people think of the old people. And I've talked to so many women who would even say, oh, no, I don't have incontinence. Oh, yeah, I leak. I have bladder leaks, but I don't have incontinence. But it really starts to affect their quality of life in terms of their emotional aspect of it. They get embarrassed. They stop going out. They stop being active. And then it's costly too. There is a study that shows women on average spend $750 a year on maintenance, on not even a treatment, but on pads and laundry and just taking care of that. So we are really trying to disrupt the incontinence industry. And what I mean by that is what they are hearing and what they're being promoted and what they see advertisements are the pads. And incontinence pad market is $6.8 billion, and it's just going up. And we want, people to know that it does not have to be a part of your aging life. You can go and get treatment. Actually, I believe the World Health Organization said it was the only condition that was like a disease state that was completely or mostly reversible. On the other side, we want to disrupt the medication market. Over $3 billion on these incontinence medications, and a lot of them have such horrible side effects. So I know this is a little bit busy slide, so let's just first take the left side. There really is a gap in treatment between women told to do these Kegel exercises, which 30% can't do correctly, and they wear pads, to surgery. So in this gap in treatment, that is where our product comes into play. And I should also mention, there is 100,000 lawsuits on the pelvic mesh for surgery. And I know that's been changing as well. On the overactive bladder side, the drugs are on this Beers list of drugs to avoid. It often does cause dementia. It causes a lot of cognitive functions, falls, and then the implants. And so there's that gap as well that our other product, ELITONE Urge, plays into. So if you ask the question, what would be the most ideal treatment if you were to design something from scratch? And we've interviewed hundreds of doctors and patients. The thing that comes up with the most is something that patients would actually use, which means easy. And when we say easy, we're talking about at-home use. Doesn't take a lot of their time. It's non-vaginal, because the vaginal devices mean that they have to lock themselves in the bedroom, be flat on their back for 20, 30 minutes, and no busy mom has time for that. It should be discreet. They don't want anybody to know that they're getting a treatment. And it has to be non-medication. Lots of times they have other medication and they don't want anything interfering with the other medication. No adverse events, and of course, effective. And so that was what we set out to do and accomplished. So ELITONE is the only non-intrusive treatment for bladder leaks anytime, anywhere. And I say non-intrusive in that not only is it physically external and non-vaginal, but it's non-intrusive on their time. They don't have to schedule time to just sit, or be flat on the back for 20, 30 minutes. So it's composed of a device, a small controller. I'll hold one up so you can see kind of how tiny and little it is, about the size of a matchbox, really. Rechargeable, and gel pads. And these gel pads are super thin, about this, as thin as a paper. And let me just show how flexible it is. So it's flexible and comfortable. And these gel pads are reusable and then disposable. So we have ELITONE for the stress incontinence, and just this year, ELITONE Urge for overactive bladder. Now, to give a little bit more detail on this, this gel pad has adhesive hydrogel, and that's the conductive areas. That is essentially, we're delivering electrical stimulation through the perineal tissues. It's user controlled, and so the patient simply needs to increase the intensity button, go as high as she can go. So because everyone's body is different, and the level that they get stimulation will vary for everyone. And super simple, easy user interface. As I mentioned, it can be reused 3 to 5 times, and then they can dispose of it. Some of the most common questions is, do they need a shave? Well, it does need skin contact. So we recommend trimming the hair, but not necessarily shaving. And it does not pull hair. This gel comes from the wound industry. Now, so what it does, ELITONE tones the pelvic floor muscles, and that results in fewer leaks as it strengthens, and the urethral sphincter is stronger. And then the ELITONE urge calms the bladder muscle spasms, reducing in those leaks. And you can see the perineal placement in this picture. So we say it's easy, external, and effective. She simply applies it to her perineal area, clip on the little controller, adjust it to as high as she can withstand. There are 35 levels in this controller. Get dressed, and then she can walk around the house, do whatever she needs to do while she gets a 20-minute treatment at home. And as I mentioned, it contracts the pelvic floor muscles for the stress incontinence and then calms the overactive bladder. We recommend 5 times a week for a period of 6 weeks. That is the initial treatment, but really, some of these women need to go 6 to 10 weeks. Often these women, they wait so long before they get any treatment that they've waited like 10, 15 years of being incontinent before they decide that, okay, I need to get some treatment. So they may need to go longer. Now, what makes the inside different is that we have really 3 modes of action. The first one is 2000 hertz frequency. And the reason why that's important is it gets past that skin barrier, past the fat barrier, directly deeper into the muscle. And so that's the targeted delivery, the carrier wave. Now then, it's pre-modulated, so what the muscle actually sees is this 50 hertz. And that is what the muscle knows at 50 hertz to contract the muscles. And we send that for 4 seconds. And then we alternate and we send it 10 hertz, which calms the overactive bladder. We cycle, so that's 6 seconds of stimulation and then 6 seconds of rest. We cycle through that 100 times in a 20-minute period. So it's really longer and stronger contractions than she could do on her own. If she, when you tell women to do Kegels, maybe they could do, a set of 10, 5-6 minutes, and then, their muscle gets tired or they just can't do it strong enough. So that is the ELITONE, original ELITONE that has been on the market for about 3 years. I know this ultrasound is not moving right now, but what we did was we did an ultrasound study to actually physically see the bladder or the pelvic floor muscles contracting and moving the bladder. It was kind of interesting because in this ultrasound study, we would say, okay, now do a contraction, Kegel on your own. And they are. And they would say, yeah, I am. And we're like, we don't see anything moving on this ultrasound. And then with our device, you can see that pelvic floor moving. Now, I'm sure you're wondering about the efficacy. So we've done a number of clinical studies. In one clinical study, 95% of the women improved. The average improvement was 71% in a short 6-week period. And in this study, women were incontinent for 11 years on average. So that is incredibly fast treatment. They all said it was comfortable, and there was an 85% pad reduction. Now, the FDA considers 50% improvement clinically significant, and in the studies was 75% clinically significant improvement. In a different study, we did a randomized control trial against a sham device. Now, this sham was our own device, but with an active stimulation, but not the original stimulation that would contract the muscles. And we saw a big difference in the ELITONE and the sham device in both leaks, pad use, and pad weight measures. Just this year, we got FDA clearance on the ELITONE Urge device. That becomes the first at-home treatment for urge incontinence. It looks almost identical. It's used in the same way, same recommended regimen. In this study, 97% of women improved, 76% was significant improvement, and a lot of the same outcome measures. The IQOL, quality of life questionnaire, improved 21.8 points, which is over like 10 times what the FDA considers significant. All 22 metrics of the QOL improved. One thing I would mention about the ELITONE Urge and how it acts is it acts directly on the perennial nerves and tissues, whereas the tibial stimulation out there is on secondary ones, peripheral nerves. And so direct stimulation is going to be better than the secondary stimulation. And this data has been presented at ICS and SUFU and will be soon to be published, we're I guess submitting it to the Journal of Urogynecology. Oh, I forgot to mention the difference between the ELITONE and the ELITONE Urge and the stimulation. It still sends out the 2000 hertz as the carrier wave, but it sends only the 10 hertz that is the calming signals for this product. And a little sneak peek is we have a device coming out for ELITONE for men. We had shelved this for a little bit, even though the Department of Defense had funded this. But every day we're getting requests, when do you have something for men? When do you have something for men? Because they don't really have any treatments that are easy at home for them. And so we've been talking to urologists for this pre-prostatectomy and post-prostatectomy to increase the pelvic muscle strength as well as for urge. Currently, the NIH is doing a study on this. So how would the patient get this product? We sell it for about $400 over the counter and prescription. And when I say over the counter, it is actually more stringent to get an over the counter indication. That means it has to get the over the counter indication, it has to be dummy proof. And the reason why we're doing this, we're not trying to go around the clinician. It's just we are meeting the women where they are. And 2/3 of them do not talk to their doctors. They're just searching for something online. And so we want to be able to provide women with a treatment where they are. So this treatment of $400 comes with the ELITONE device or the ELITONE Urge and 2 packs, which is 10 gel pads. We sell it almost entirely on our website, elitone.com, but also on the CVS pharmacy online, cvs.com. And we make it very accessible in that they can pay for it with HSA, FSA funds. We have monthly payment plans so that they can pay $34 a month. I mean, that is cheaper than pads. I saw a study that shows that women on average are spending $60 a month on pads. We have nationwide Medicare approval coverage. They make them jump through some hoops, of course, that they need to have shown failed 4-week structured program. Medicaid covers this in 22 states. Most of the private payers cover it with a lot of restrictions, of course. And considering that we give a 60-day guarantee, which is more than any of our competitors, and is longer than the actual treatment period, we are finding only a 3.6% return rate for non-efficacy, in that it is highly effective and women are motivated to really make this work for them. Now, you may ask, okay, there are so many recommendations. Where does this really fit when I am talking to a patient? So we recommend it be the second line of treatment. We know Kegels will always be first line and behavior modification, but right after Kegels, they've tried Kegels, maybe it works for a while and then it stops working because they forget to do them, or they just can't figure it out. We recommend the ELITONE device to be used right after that. The recommendations, of course, are always based on severity. You're not going to recommend surgery when they have mild incontinence, but our device kind of fits quite the length of from mild all the way to right before surgery. And it is this infographic kind of shows the mild to severe versus the invasiveness. So for the least invasive, it's the most efficacious. Now, on the overactive bladder side, we again recommend it as a second line treatment after diet modifications. But when you compare the risk and side effects to the 2-year cost, it is, again, the least risky and the least expensive. So I like to end with just some of the language that the women use. So like Marty in the middle, she says, I had 10 children. I didn't think anything would help. And then Nancy talks about, I am not afraid. I mean, some of these language, without fear. Oh, Joella, we were talking to Joella's daughter, and she completely would not go out of the house anymore. And now she says she can go anywhere without fear. So that is why we do what we do. And I know with all of you, we can get the word out and it be, a nice, effective, cost-effective treatment for women out there. And our goal is so that people don't, wait until the very, very last minute to get treated, because they're absolutely desperate. We're hoping to reach women earlier. So thank you.
It was great. Really enjoyed your presentation. This is a section where you folks that are out there listening live, go ahead and put in your questions on the comment box. We'll bring those up. Lori will bring those up to the screen. I had a couple of questions since I get to go first. Now, obviously, it's an electronic device. Is it running off a battery that's rechargeable, a battery that's replaceable? What's the usual life of that?
Yes, it's a rechargeable battery. It's a simple USB recharging. They just simply, this blue port opens up and that's all they do. Great.
And then you said the normal treatment was for 5 weeks. I'm sorry, 6 weeks, 5 times a week for 6 weeks. But there's no drawback. They could do it longer if they weren't having results, or do they sometimes repeat this, or? Correct. They can do it longer. We typically recommend 6 weeks is the minimum, and it typically is 6 to 8 weeks, 6 to 10 weeks. I remember one review that she said, she didn't think it was working for her, and then it took till the 9th week, but then she was able to be pad free after that. Yeah. I do a lot of urodynamics and throughout my career, and I can tell you that one of the big problems when you're doing urodynamics is you're trying to fill the bladder, and sometimes it'll contract. That's the overactive bladder syndrome. You see it right on the machine. So I was using it as a time to teach Kegel exercises because, as you said, most patients have difficulty doing them correctly, and it's true. When you can see the pressures, you just see how bad they are. But when you get the patient to properly do a Kegel exercise, I could calm their bladder. I could see that on urodynamics. So the principle I know is effective, and I think that some external device like this that could work to do that for the patient makes a lot of sense to me. Yeah. Panel, any questions that you have, feel free to not let me occupy all the time.
I have one.
Go ahead, Andrea.
Yeah, thank you. Gloria, I really want to thank you for highlighting the quality of life issues that incontinence has on women. And Lace brought up a great point as well. A lot of times I'll see patients in the clinic. I ask if they have incontinence and they'll say, just, normal female stuff. I'm just wearing 7 or 8 pads a day, and that's pretty normal.
Normal.
So yeah, I think and also, if you're watching these commercials and all the advertisements that the pad companies have out, they really normalize this. You'll see a, 30-year-old woman dancing at a wedding with a pad on. So, but I did have a few questions. I have a lot of patients who have mixed urinary incontinence. It sounds like the device for stress urinary incontinence and urge urinary incontinence are separate. Can you talk a little bit about what I might be able to do for a patient who has mixed urinary incontinence?
Yes. So we recommend our original ELITONE device because, as I mentioned, it actually sends out both signals. So it sends out 4 seconds for the stress and then 2 seconds for the urge. Now, we only got FDA indication for stress incontinence, but if they do have mixed, that's the one that I would recommend.
Okay. And then I just had a few more questions about the studies that you did. It sounds like on the outcomes, your 2 outcomes that you were looking at were reduction in pads, and then you were also using, is it the IQOL survey for patients? Were there any other outcomes that you were looking at?
Oh, yeah, those were secondary measures. The first outcome was the reduction in leaks.
Okay. And was that measured on a bladder diary, subjective, objective? How is that measured?
Yes, subjective, bladder diary, and then the RCT, though, did the pad weight. So that's the objective measure.
Okay. And then can you tell us a little bit about the study population? How many participants and what was the average age of those participants?
Yeah, so 18 to 80 years old was the range. The average age, I think it varied between the two, but stress incontinence one, it was maybe 50 years old, 51 years old. And then on the urge one, it was a little higher, like 58 years old. We did a number of studies. The very first one was just a 20 patient single arm. The RCT one was close to like 45. And then the urge study was, I think it said around 35.
Okay. Thank you.
Sure.
Hey, Lori, I see we've got a few
We got a bunch of questions coming in.
Oh, okay.
Let's go ahead and take some questions from the audience.
Sure. So the first one is from Susie Swain. Can women get a sample to try product before they purchase?
Unfortunately, you can't get a sample. What we do is have payment plans. And so if you need to return it after 60 days, out of your pocket, you've only paid $35 or $60, and then you get that all back. So that is the sample plan. But there's really no sample that we can give out. Oh, and some of the payment plans now, so we have PayPal, Pay Later, and Affirm. You don't even pay anything in the first 30 days. So it's called like Pay Later.
Great. Susie had another question. How do women know if they're using it correctly?
You will feel the contraction. So, and probably another question is, what does it feel like? Well, on the surface, you will feel the tingling, just like a tingling on the outside. But then as you increase the intensity, you start to feel it transition towards the tightening internally. Now, we do know that everyone's different. And so the placement varies for some people. And so we do recommend the first, 3 times you use it, try different placements. Try it a little further back, try it a little forward for the best placement for your body.
Great. And then Janelle, so about pelvic muscle tension patients, some patients have more tension in the pelvis than relaxation. Could this device make things worse?
I would say yes, that the ELITONE device that contracts the muscle, it could make it worse. And so we don't recommend that device for them. what we've been hearing anecdotally, now we haven't done a study on this, is some women have been using the ELITONE Urge device for if they're hypertonic, and that has actually helped them. But we've just been hearing it anecdotally.
And I'm just going to say Rajesh because I'm not sure how to pronounce the name, but this device, any side effects on intimacy or sex?
Well, I don't know about side effects, but what we've been hearing, again, anecdotally from our customers, is that their partner's been feeling them being tighter, that it's had a positive effect on orgasms, and that just in general, like postpartum, they're able to get back to normal, get back to being their tighter self down there faster.
I would think that even just the fact that some people don't want to be intimate because they're afraid they're going to leak on their partner. So I think that might also be another positive effect for this device.
Right. Yeah, we've had customers that said, I feel I can date again.
Yeah.
And then Susie, can providers get a dummy device to share how to use with patients?
Yes. Oops. We can arrange that.
Great.
Yeah. Do you have sample devices or something that you send out to offices that they can show patients what this looks like? Or
yes, we have non-functional units, and then depending on the office, we can work out some functional units as well.
And how would you go about getting that?
So our email is clinicians@elitone.com. Contact us. We just want to make sure that we talk to you first so that you understand, how it's being used and understand your practice.
Great. Any other comments from our group here? Lace, any thoughts?
I have a question. So,
Yeah.
I'm sorry.
I have a question.
Go ahead.
Go ahead, Lace.
No, go ahead.
Here. So you had mentioned, the kind of over-the-counter, dummy-proof, and making it available for, women who might not be sharing these symptoms with their clinicians. As a clinician, a big part of what we do is not only to educate patients on a product or an exercise or whatever it is that we would be recommending, but we also, have methods that we try to utilize to measure success, right? Because we all know someone can say that they have a leak, it's not great. And as you mentioned, 50% improvement is showing some efficacy, but how do you measure that for those patients who may not be going to their clinician, right? And maybe they just found you online and now they're trying it on their own, but they don't really want to go to the doctor. How do you measure that?
How do we, as the manufacturer, measure that?
Or for the patient, how would the patient say, this seems like it's being successful because they've perhaps never seen a clinician and know nothing about bladder diaries or measuring how many pads you're wearing a day.
Right. Probably one of the easiest is the pad usage. It's not very exact, but if they are spending money and going from 5 pads a day down to 1 pad a day, that's significant, and they will see that in their pocketbook. Now, clinically, they would probably need to have a bladder diary, and in fact, it's often helpful to have that at the beginning anyway, because a lot of women don't realize how much they leak and don't actually realize how many pads they are using. So it is nice to have that baseline.
Yeah. Is that, would that be included with the product? Say, just some small guidance on maybe you should be keeping track of, your voiding function, how many pads you're wearing.
Yeah. So we have a resources page on our website that has a bladder diary download that they can download. we try to get them, get their emails. So we send out a series of emails to follow up on them to say, okay, now make sure you're trying different positions. Okay, are you increasing your intensity? Reminders like that.
Sure.
And then check-ins too, like 3 weeks, 4 weeks later, to make sure that they're complying.
Sure. Yeah. I mean, that's, obviously incredibly helpful. If someone is trying to use a product as such on their own, say, right? So.
Right.
You don't happen to have clinicians that are available by phone to talk to if you had like a question, am I using it right? Or
we do, and we are onboarding more now too.
Yeah, it seems like it's a natural progression for this.
Yeah.
Andrew, did you have something?
I just wanted to clarify. So you can use this product when you're doing chores around the house, when you're walking, when you're moving, or is there some specific position you have to be in?
You could use it. I mean, that's when we showed in our clinical studies, we didn't give them any restrictions. So you could walk around, you can do anything you want. And it's funny, we want people to have a routine because that routine will help them remember to do it. But we get emails in saying, oh yeah, this is when, I put on my makeup, I use the ELITONE device, or when I walk the dog, or, or maybe just when I watch TV at night.
Yeah, that's great.
Yeah. It's one of the great things about the product is the fact that you don't have to go to a doctor's. The time you waste going to a doctor's office to be treated, people's schedules are busy now. It's hard to get that time.
Right.
I know that one of the failings of gyms are you get a gym membership and you got all these ideas. I'm going to go work out. I'm going to do all the things that I should do. But then you got to drive from your house to the gym and you wasted that half hour, and the gym back home, that half hour. That's 20 minutes is your treatment.
Right. Unfortunately, we saw the studies that showed that those that are recommended pelvic floor physical therapy, as effective as it is, only 13% will actually finish the whole, go and finish. And so that's unfortunate. And then we've had other women that said, my closest pelvic floor physical therapy is an hour away, or it's a 6-month wait. So that's unfortunate as well.
Yeah.
Sure. Yeah. No, convenience nowadays.
That's such a thing.
Sure.
Yeah. I had a question. I have had some patients use some similar over-the-counter devices, and some of them have reported pain and pelvic pain after using those products. Can you touch on that? I don't know if these are vaginal devices or external, but we almost never have reports of pelvic pain. If anything, the only adverse events that we see are redness on the skin, which typically goes away, and it's natural. There's more blood flow to the area. And if anything, a few patients have just super, super sensitive skin. And so even though it's super biocompatible, there are some patients that they say, I can't use it because I have super sensitive skin. Okay. And how quickly could you use this product in the postpartum setting? Very quickly. We say before 6 weeks, they should talk to their clinician, but as early as 6 weeks.
How long has the device been out?
The ELITONE device has been out for about 3 years now, and then ELITONE Urge just came out in May of this year.
We have a question from the audience.
Yep, this is from Janelle. Can patients expect to need to restart the treatment after some amount of time?
Great question. We wouldn't say restart treatment. We say, they would need to go into maintenance mode. We are talking about muscle tone for the most part. And so maintenance of the muscle tone. Now, what that looks like, unfortunately, I can't give a great answer because some of the young postpartum women, we've heard stories a year later, they are still continent. They are still good. For some of them, it teaches them how to do Kegels. And so now their Kegels are effective, and they can use that for the maintenance. But some of the older women, they their muscle tone isn't as great, and so they use it maybe once a week. Personally, I've had I created this device because I had issues myself, and I kind of forget about it for a couple of months, and then if I start to leak, then I do like 3 to 4 treatments.
Susie has a pretty good question here. Any idea when a male device will be available?
Yeah, so we are in clinical studies with NIH, and it's interesting because the NIH came to us and say, "What do you have for men?" And we told them, but we were like, "We don't have the resources to do that, a clinical study for FDA approvals." And so they said, "We'll do it." And so they are doing that. We may still do a study for the urgent continence side, but that would probably still be at least a year away.
Great. You mentioned for Medicare that there was a something had to fail for 4 weeks or something. What was considered a failure for Medicare coverage?
They needed to have tried Kegel exercises, but not just like do Kegel exercises on their own. It had to be a structured Kegel program recommended, prescribed by a clinician that they've done at least for 4 weeks and then failed that. And that needs to be in their chart notes.
That's what I was
so
gonna
they
ask
need
next.
to bring a prescription and the failed Kegels on their chart notes. Then we send that to our providers, our insurance providers, and they can process that.
And you've had good success with approvals?
Nationwide Medicare approvals is pretty easy. Where it gets a little complicated is when it becomes Medicare Advantage, and then there's so many intricacies with state-specific ones, and they all have different rules. And we are still onboarding more insurance providers in all the different states. So not all the states are covered yet.
Yeah. It would seem like something they should get on board with just for cost effectiveness. When you look at the cost of pads and these other things.
Exactly.
Yeah. Do you know off the top of your head, is it covered in Wisconsin?
It is.
Great.
Yes, Andrea from practicing in Wisconsin, right?
Quick question. So you talked about, the failure and then how you guys need certain notes, et cetera. Am I correct to assume that your company provides assistance to the clinicians when you're looking at eligibility, or perhaps, sending a claim to the insurance, et cetera, to kind of look into the coverage for the patient?
We don't look into the coverage for the patient. What we do, though, is we have a reimbursement page and a detailed written order that outlines exactly what you need. And so you could find that if you go to elitone.com/resources or elitone.com/clinicians. And then if there's anything missing, we will typically go back to clinicians, say, hey, we're missing chart notes. And then we pass it on to insurance provider. And if there's still anything missing, then the insurance provider or that DME will work with the clinicians to get what they need.
Gotcha. What about, do you have any assistance for under or uninsured patients who may not be able to afford or might not have the insurance coverage?
Unfortunately, no. We do know that in 22 states, it's covered by Medicaid. And I believe it's pretty good coverage, but it's state specific.
Sure.
Well, great. Anybody else out in the audience have questions? Feel free to put those through on the comment box. Otherwise, I think we're getting close to the end of the show here. I'd like to thank everybody.
I had a question regarding the reuse of the pads. Mm-hmm. You mentioned that the pads can be reused. How many times on average can they be reused? And how many pads comes in the initial kit?
Great question. There are 10 pads that come in the initial kit. We count 3 uses each, so that's 30 treatments. In actuality, women are using them 6-7 times. And basically, they can be reused until they lose its stickiness, because then the conductivity starts to wane.
Yeah. We have found with other products, patients are very smart and can figure out how to reuse things. If it did lose its adhesiveness and someone used tape to hold that in place, would it still work?
It potentially could if there's good skin adhesion, yes. The other thing that I would mention, though, is because it's non-vaginal, the infection rate is non-existent compared to the vaginal devices. So the reuse is also pretty safe.
Thank you.
Great point.
Yeah, quick question with the reuse. So, you kind of, I think we saw on the picture, it comes on a little sheet and it's, stuck to it. So just like a sticker, you peel it off. When you're done using it, do you just put it back on that? How do you keep it, until your next treatment?
Yeah, this is the liner. And we just say, put it back on there. We provide a foil pouch. So resealing it back into that foil pouch helps it stay hydrated and not, dry out.
Gotcha. Thank you.
If someone wanted to bring this on a plane, any issues with that?
No issues, no.
Elizabeth had a question. What is the recommended cleaning of the pad in between uses?
So you could wipe down in between the blue sticky areas. It's not recommended to clean the blue sticky areas because it would actually just lose its stickiness, but you can put drops of water on it if you need to.
Well, it's great. I think we've had a great conversation. Appreciate you coming out and sharing your time with us. Talking about a great product. I think this really has a lot of applications, and I think we'll see it utilized more and more. I've always found that things that are easy, as you said, easy to use are the most successful. Patients, don't like things that are complicated. They don't like things that hurt. So I think this has a lot of those boxes that it ticks off. So, well, great. I'm just going to give a little program notes about next week. We're going to have some company by the name of Gemini who's going to be joining us, and they're going to be talking about urodynamic equipment and what it can do. And I've got a little...
Join us for a webinar on how urodynamics can help you meet the challenges of a changing medical environment. The medical environment is changing rapidly, and healthcare providers are facing new challenges. Urodynamics is a diagnostic test that can help providers diagnose and treat a variety of urinary incontinence and other lower urinary tract disorders. In this webinar, we will discuss how urodynamics can help you meet the challenges of the changing medical environment, changing your practice to be more efficient, improve patient outcomes and satisfaction, improve your bottom line. Check out episode 60 to learn more at uronurse.com.
All right. Well, once again, experts, thanks again for all your help. Gloria, it's been great having you on the show.
Thank you so much.
We are going to be finishing up, and have everybody out there, we want you to make sure you have a nice weekend. Enjoy the few nice days left to the, I guess, almost fall now, going out of our summertime. See everybody next week for another great show.